I am very happy to be at the current job here in South Dakota. I'm not physically right in South Dakota right now, but I'm home in my home country and working with basically Lakota tribal members who are in nursing school. So it's a perfect job for me at this point. Next. So we have 4 learning objectives. One is to give my perspective as a Lakota Nurse Mentor, and of course lived experience, simply because I've been a nurse for so long and have had many years of experience. And the second objective is to identify the 7 Lakota values that our Native American Nursing Education Center uses as a foundation for what we do. And the third is to explain the meaning of Tioshpahe, which is a Lakota word meaning extended family, and why it is so effective for Native American students. Number 4 is to describe the innovative strategies that we utilize for recruiting and retaining our Native students. Okay, next slide, please. This is South Dakota, and many of you may have been there, and I know there's several of you there now. There's 9 reservations, and they're all in green on the screen. And the reservation I grew up on is the Oglala Sioux tribe community. So next slide. So you can see on the left side of your screen 3 circled communities. The one on the far right is Kyle, or it is now renamed Little Wound Community. And that's where my father is from. And the circle to the left is the Manderson District. And that's where my mother's family came from. And of course, the third circle in red is up toward the left upper corner, which is where Rapid City is. And so it's driving distance. I know many people who work in Pine Ridge and commute from Rapid on a daily basis. There's many people who do that, and vice versa. People who live in Pine Ridge have jobs in Rapid City. Okay, next slide. Since I'm talking about my perspective as a Lakota elder, I need to give you a little bit of a history of who I am. And so in the next few slides, I will show you some of my grandparents' pictures and how I learned from them. This picture is my paternal great-grandfather, Stabber number 1. In those days, we didn't have first names. And this picture was taken in Washington, D.C. On the left, you could see the place where he was in Washington, D.C. during Ulysses Grant's presidency. And it shows that the group that went there, the group of Dakota leaders went there and headed by Chief Red Cloud to speak with the government officials regarding some issue. And I'm sure it was something that was very difficult to do in those days. This picture was taken in 1872. You can see on his hair, his right braid is very neatly covered with a cloth, and that's usually red. The left side of his hair is not braided, not wrapped. It's sort of chaotic from our perspective. Everything has symbol. There's a lot of symbolism in our culture, and that would depict a feeling of disarray. And of course, in that time frame in our history, we did feel that way. And I'm sure they were there to negotiate something that would help the people. Next slide. And this is my paternal grandmother. And this picture was taken in the early 30s. And she's holding her first grandson. And this horse is a giveaway. in terms of honoring her first born grandson. And you could tell it's a giveaway because there's gifts draped over the horse and the tail is wrapped in a certain way. So like I say, everything is symbolic in our culture, and it keeps you thinking and feeling grounded. And in today's world, this grandmother would be called by the grandchildren the general because she was quite the boss.
Apologies all, I think I just cut out.
Yeah. Okay.
I'm back.
This is technology. And the next slide is my maternal grandfather, and his Lakota name was killed on horseback. And this is a picture that was taken in 1899. And he was a young man, and you could see that he was a dancer. That is a dance outfit that he is wearing. And this grandfather is the one that taught us. I was born and raised in Pine Ridge on the Manderson District, and we lived near the White River. And I remember him quite well as our teacher. And his teachings of our values was through storytelling, not only just storytelling, but singing the stories. So you can imagine as a child, at dawn and at dusk, he would sing the morning prayers and the evening prayers in the evening time. And following that prayer would be a story about one of our values. So he would think about possibly generosity or honor, one of our values that we were supposed to learn and to live by during our lives. And that was his way of teaching us. Next slide. So this is the White River in Manderson District. It's quite gray looking because there's alkaline soil in that area. And on the left side of the screen, you could see that there is a sandy beach-like part. And this is what one of his lessons to us was, when we needed water, we would go to the river. A group of us older grandchildren were instructed to dig holes in the sand along the river there. And as we were digging the holes, he would tell us stories of how we hold water very sacred, and that it means a lot to us because it's our life-sustaining element. So he had a way of teaching that was very interesting for children because it was always in story form. But when you think about lessons in story form, it's actually teaching you how to be a critical thinker, deductive and inductive reasoning, and thinking about what he just told you or saying to you. And of course, when you hear that twice a day for several years, then it becomes who you are as a person. Next slide. So when I got older and my father went off to World War II, we moved, my mom and her sister moved with all the children to Pine Ridge. This picture was taken in 1891, way before I went there, of course, but you could see on the left side that families actually moved close to the Pine Ridge boarding school and pitched their tents or teepees and lived by the boarding school so they could be near their children. Typically, the children were taken away by force. This was part of the government policy of forced assimilation. And the picture on the right, upper right, is something that looks familiar to me because this is part of what we did as elementary school children, is that I started there in kindergarten. We were workers in the afternoon. We went to school in the morning and then had to do chores all afternoon, like this group of little girls are doing weeding a garden. And the picture on the lower part of that is a classroom setting with children that don't necessarily look very happy. Okay, next picture. After World War II, when my father came home, he could not find a job on the reservation. So we moved to Rapid City. This is an aerial view. And the blue line there is the Rapid Creek. It's a creek that runs through town. And the circled area in red is where the Indian camp was located. My parents evidently knew we could not, likely wouldn't be able to rent a place because the population there actually didn't want us there. So, but we went there because of the availability of jobs and more opportunity for my father. Okay, next slide. And this is what we lived in during that time because of the fact that we couldn't get a house. We brought our own tents to live in. And it was a lean time, of course, until he was settled into a job. He was a construction worker. He was an iron worker. And I remember him coming home with rust on his shoulders. And it was because he would carry those steel bars up ladders, and he used to say he was steel tire, and of course he had very, very strong hands, and he was a good provider in those days as far as we could go. We were not feeling marginalized as children living in these conditions because everyone around us were Lakota people. And so it was more like the extended family setting that we were used to. But when you went into town, you could feel the difference. You could feel the prejudice and the discriminatory behaviors and words that you heard. The first time that we went into town, I was with my father. I must have been about 9 or 10 because I was able to read. And we came onto the streets of Rapid City, and I was excited to be there. This was something new for me, to be in a city. And I saw a sign in a retail store window. Retail store windows typically are low to the sidewalk for the displays. And I saw a sign that said, "No Indians allowed." And of course I knew that was wrong. It didn't seem right to me to see that. So I stopped short, and he looked down on me and said, "Daku," meaning what? And I said, "Daku we," meaning why? And he said very wisely to me at that time, he said, "Because they don't know us." And of course, that's still a problem today, about 70 plus years later, that typically the public does not know who we are as Native people because we're not included in a truthful way in the textbooks, the history textbooks of the US in our school systems. And so, of course, that's one of the things that needs to change. Okay, next slide. These are my parents with my son, my oldest son, Jim, and they were very courageous to take that chance to move to Rapid City. And so, of course, they didn't have necessarily a comfortable life, but they stayed together and worked together to make our family functional. Okay, next slide. So I finished high school in Rapid City, and I enrolled in the local diploma nursing school, St. John's McNamara School of Nursing. And this is the class of 62. And of course, in the days when nurses wore caps and all white clothing, including stockings and shoes. And we were educated by nuns who were very good teachers. They were good disciplinarians, and so they taught us self-discipline in our 3 years of going to school here as a group of young South Dakota young women. And of course, my picture is on your right bottom, Beverly May Stabber. And I always say to people, and I wear the same glasses. It seems to be the same style. But this was a good group of women. We still meet 58 years later, those of us who can still travel and meet someplace, we have an annual reunion. Of course, we didn't this year because of COVID. Next slide. So this leads into my current work in terms of nursing. We have a nursing workforce in the United States that is always shorthanded. We know that. And especially in our communities with Native American, our Lakota students. So our work at SDSU College of Nursing is to support the students from the recruitment phase on through licensure. And SDSU has 4 programs in the state, and we are located in the far western part of the state. This is where most of the Native American, the reservations are located, and the more populous side of South Dakota. So the students, of course, are attracted to the Rapid City program because it is closer to home. And Rapid City itself has a very high population rate of Native people. It fluctuates, but it's typically 15 to 25%. And in the whole state of South Dakota, 9% are Native and basically the same tribe. And only 3.2% of the nursing workforce is Native American. So our program hopefully changes that statistic for increasing numbers of our own people taking care of our own patients and families. Next slide. So our focus, like I said, is Western South Dakota. And this young lady who's shown on the map actually graduated about 2 years ago and is now working in Cheyenne River in the IHS hospital there. And so it's working. They keep connected with us after graduation, and it's like a family. So Urban Rapid City and the reservations are listed here: Cheyenne River, Crow Creek, Lower Brule, Ogallala, Rosebud, and Standing Rock is basically the population that we serve in terms of their students. And of course, we're looking to expand our program to cover the whole state with time. When we first started this program, what we did was hold talking circles, meaning we went to the communities and literally sit in a circle and focused on questions to the attendees. And they were basically pre-nursing students, nursing students, and graduates, all in the nursing area, and whoever they wanted to bring with them. It could have been a parent or a spouse or a significant other. And the thing that happened during this early time when we were just starting our program, the students identified a need to know more about their own culture and language. That is part of the result of forced assimilation when we were forced actually to not use our language and practice our life ways. Next slide, please. This is our team on the right side, all in a row, the headshots. There's 4 Native people and 2 non-Native in our team. The one on the far left with the bright shirt, of course, is myself. And then the next lady next to me is Val Big Eagle, and she is the academic advisor. And the lady next to her is Mary Isaacson. She has a PhD, she's faculty and a volunteer with our program, and she mentors the graduate students. And the next picture is Christine Clemens, and she's our assistant dean. And the far right of your screen is Renee Zocker, and she's from Cheyenne River, Native, and a full-time faculty. And the one picture down below is our very newest member of our team, Kathy Labonte, just retired from IHS as public health nursing. And she has a master's as all of us do, and two of them have PhDs, but Kathy has a master's in nursing education, and her cohort of students that she mentors are the pre-nursing students. When the students are going to school, to college, to attain their chemistry and all the prerequisite courses. This is the cohort of students that we typically lose more than the nursing major. And the nursing major population are my students that I mentor. But Kathy will focus on, this semester, will focus on the pre-nursing students and have them feel like they belong and introduce them to nursing in different ways, in different innovative ways that we find to connect our students with who we are. The picture on the left is a group of us. We did this for recruitment purposes. All of us that are pictured there are Native. On the far left of your screen is Renee Zocker, the faculty from Cheyenne River. And the next picture with the aqua skirt is Jasmine Goodiron, and she was a senior at that point in time, ready to graduate, and she's from Standing Rock Reservation. That's me in the middle, and I'm from Oglala, or Pine Ridge. And the student next to me was a freshman at that point in time, and she's from Crow Creek Reservation. And the far right person is Val Big Eagle, and she's from Yankton Sioux Tribe. And so we get together quite frequently. We collaborate not only with each other, but with the faculty and staff and the community. Next slide, please. So the theme of our program is taken from Sitting Bull. Back in the late 1800s, he made this quote, which is what we do actually when you think about it. And he said, "Let us put our minds together and see what life we can make for our children." Now, that's what these pictures depict. On the left is one of our students. She's now graduated, and that's her little girl. And we got to know that little girl very well. When students come to our facility, we have a toy box for them so that they have something to do while the mom is getting a mentoring session or advising session, or just needing a place to study and not having childcare. So that's what we mean by intentional mentoring, is that we don't just focus on the student, we focus on the family. In our culture, family is quite important and close, and we have more than one grandmother, for instance. When you lose your grandmother, an auntie will step in and she becomes your grandmother. So we're never without relatives, and that is part of our culture. On the right side of the screen, you will see a picture of a drum group, and the gentleman on the left with the aqua shirt is the teacher of these young boys, teaching them how to drum and sing our songs. Next slide. So we're guided by the traditional Lakota values that I learned from my maternal grandfather when he sang stories about one of these values on a daily basis, twice a day. So the 7 values that we use as a foundation for our program are courage, generosity, fortitude, wisdom, respect, honor, and humility. So those are the 7 that we keep in mind as we work with our students and mentor our students. Mentoring is the overarching reality of our program. Next slide. The medicine wheel is a symbol that's quite similar to people in the Native communities and not just in the Lakota tribal people. The 7 values are the basic 4 are in the middle, and those are the 4 directions. There's so many lessons that you can give just looking at the symbol of the medicine wheel. The colors are significant, but the values I'm talking about are the basic 4 of generosity, fortitude, wisdom, and courage. And you could see that around the wheel. And on your upper left is honor. So that's another direction up. And down is respect, Mother Earth. And then the one on the far upper side of your screen is the 7th value of humility, which is within each one of us. And so the pointer goes to the middle of the whole wheel there. So that is the 7 values that we utilize on a daily basis. Next slide, please. So the symbol of our program and the way we support our students are the basic 4 in terms of what we do for our students. Our academic advisor is quite talented and gifted in finding scholarships for our students. And so that's an ongoing process. It's not just at the advising time, but she's continually looking for ways to assist our students in the financial realm. And we do have stipends. For instance, each student that is mentored gets a stipend at the end of the semester. And the amount depends on how much we have, of course. And the scholarships and the outside funding meaning the 2 foundations that assist us with our support financially of our students. And we have financial planning sessions or how to budget. And we have many community members who donate gift cards. That is huge for us because the need is there on the biological level in terms of food. And so we have gift cards for students for Walmart and gas cards for getting to and from school and clinical when the need arises, and that is fairly frequently. So the way we keep that funded is through the community and our faculty and ourselves, that we have $25 gift cards to give to students in need of food. And that is a reality among our population. Okay, next slide. Academic support. Of course, the academic advisor will start with the formal part of it. But during that time, typically the academic advisor is the first person to sit and have a meeting with a student. And she sets up in her traditional way of thinking the idea of the tioshpahe, meaning the extended family. And she actually says it. She's quite grounded in tradition and quite educated. She's currently working on her doctorate in higher ed. And so she has this wonderful way of setting the tone, so to speak, when a student is new to our facility. And then, of course, she introduces us as the mentors. And I'm always introduced as Unchi, meaning grandmother. And that's an honor for me because of my age. Of course, I'm a grandmother. I'm a great grandmother. And that is a feeling that is set right off the bat for the student, that this is somebody you can come to because she's going to be able to help you in different ways. And that is part of our innovative ways of retention, is to create this feeling of belonging as an extended family. And of course, we have tutoring. that's formal within the program at SDSU. And we do have community members who have volunteered to tutor our students. For instance, one of our tutors is a retired nurse midwife, and her first degree was in English. And so she tutors our basically the pre-nursing students who are having difficulty writing papers for research or for assignments. And the mentoring, of course, is there continually in all aspects of our program. There's peer mentors, those students who typically just come forward and say, it's not a formal program, but we have students, classmen, who are wanting to help the younger students new to the program. And that's just sort of a spontaneous offering of helping the younger students. And one day we'll make it into a formal program, but right now it's working just fine. And so the community part of mentoring, hopefully our Native American Nursing Association will get back on activity. Right now we're dormant because of the COVID, but we're wanting our Native students who are already licensed to be mentors and to help us with our program as it grows in population. We have a resource room for the academic support where we have research studies that are displayed for students to browse through, and they're actually paper copies. And so they can get some idea of their level of interest or what they would like to research in various, with various assignments. We have the study pods. We have a student picture here on your left of a student studying at one of the pods. And of course, we have signs when we have students in there to be quiet and be respectful for their efforts. And on the far right is a picture of 3 students that I accompanied to a national conference. This was in St. Paul, Minnesota, where the National Native American Nurses Association held a conference, and these 3 students were recruited to present a poster for the audience, and the 3 of them did a beautiful job. Next slide, please. The cultural support includes, I've already alluded to, Soup and Learn, and then we have the honoring ceremony at graduation time. You see a picture of 4 students on the right upper who graduated a year ago, and they each receive a star quilt, and it's draped on them by a mom or dad or whoever they choose. And it's a ceremony that's conducted by a medicine woman in Rapid City with appropriate songs, prayers, words of encouragement. It's a beautiful ceremony that we have at the end of each semester. We have talking circles. We did, in response to the COVID crisis this spring and summer, we started doing virtual talking circles where we had Zoom meetings with the students and called it talking circle because that is a familiar term to our students, and they know that at talking circles it starts with a prayer, knowing that the things that they bring forward may be something that needs to be tended to in the healing part of our lives. And so we did that virtually this summer, all summer long, and we will probably continue that if necessary for this summer. We have Inipi, which is Sweat Lodge. It's another Lakota ceremony. And recently, one of our students requested one for herself because of some issues she was having to deal with in her personal life. And so we did, 4 of us went with her and the medicine person who conducted the ceremony for healing. And the next thing we have, of course, our community higher education partners. There are, Black Hills State has a Native American club that we collaborate with and support. And we work with OLC students to, is this actually in the academic realm? They can come and use our facilities for study at any time. So we're not only strictly for our own university in terms of outreach to Native students who are wanting to become a healthcare provider. We're supportive of all Native students who want to go this route and do the best we can to help them. And so a part of this whole effort is to increase knowledge of ceremonies and our way of life. And the picture below is a picture of the Great Plains Native American Nurses Association membership. And the very first person on the very left of that picture is Marcella LeBeau. And she's a well-known nurse who served in World War II and is quite knowledgeable in history and is a wonderful presenter of history with her life as a nurse in World War II. Next slide, please. There are some examples of the type of soup and learn subjects that we covered so far in this is just a portion of them, of course, but the one person at in the picture is Lula Red Cloud, and at this session, she was teaching about self-care from the Lakota perspective, as well as the Western way of self-care. And of course, we know that's important for the nursing profession, is that sometimes we have compassion fatigue as we work in our different areas of nursing. And she was talking about how to take care of yourself so that you can take care of others. So our next slide. So the social realm of support, of course, is the student lounge, which you see a picture on the lower part of your screen. And it's a comfortable room. We have a diffuser with sage oil going at a very low rate. And it's so relaxing. You can actually see the students' shoulders drop when they walk in this room because we've purposefully made it comfortable and very native. So, and of course, we always have food. In the corner there, you'll see a small refrigerator and a microwave and a coffee pot and food. And so we always have food available for students. So if they didn't have money for lunch, they know where they can come for lunch. And the upper picture shows our float that we had at the Native American Day Parade. We participate in that parade every every fall, I'm sorry. And this picture shows one of our students, and her little daughter is facing the other way. You could see the top of her head. But her grandmother sewed a scrub, a little blue scrub to match her mother's scrub, and she had a stethoscope around her neck. And the crowd just loved that picture. And the other young lady in the background is a school-age child who wants to be a nurse. And in the very background, under the umbrella, is Marcella LeBeau as the elder nurse leader of our communities. So the social part of what we do, we always include children. That is part of our culture, so that's what we normally do. Okay, next slide. So part of our work, of course, is to empower our students in professional development and leadership. And the various conferences that we attend is for the students, of course, to prepare them to present in whatever way they choose to, so that they're comfortable doing it. The first 3 years, they wanted to do posters. But this last conference we went to in Bemidji, Minnesota, was a podium with two students presenting their research that they had conducted during their population-based clinical experience, and they did very well. So our program is growing in terms of our students stepping forward. Their confidence is there because of the support that we give them in different ways. Okay, next slide. So the outcomes, of course, is increased interest in pre-nursing students and others. So currently, I think this is our most current numbers. This was true a month ago. We have 30 Native American students in different levels, 15 in the pre-nursing, 15 in the major program, the major students, and the ones that I mentor, this cohort of students. The next is 11 pre-nursing students, and that's the job of our new mentor, Kathy Labonte, and she will focus on pre-nursing students. And then the third group of students are associate degree nurses who are doing online curriculum to attain their baccalaureate in nursing. And the mentor that's assigned to them is another volunteer, and that's Renee Zocker. She did this very same thing. She became baccalaureate and eventually master's prepared through this STEP program. And then, of course, we have one nurse practitioner student who's mentored by one of our volunteer faculty. So we try to make, we do make mentoring a central part of what we do to continue to support students. Next slide. The outcomes, a 98% retention rate, and NANIC was officially recognized by the Board of Regents. And of course, our mentoring program is growing, and there is increased community interest. And we do collaborate quite heavily with other colleges, universities, and organizations. Next slide. Future vision is to continue what we're doing, implementing new ways of recruitment retention as needs arise. And we're pretty independent in our ability to do this because we rely on the Native culture to make it work. And so far it's been successful. And we do always encourage our students to pursue higher degrees as time goes on. And then always in search of scholarships and funding availability. Next slide. So the future vision is to ultimately impact the current health inequities and disparities among the Native populations in our country. We do know that the health disparities and inequities are horrendous, and it's basically preventable. So we need to focus more on prevention as time goes on. And this is part of what the students learn during the mentoring sessions with all of us. We have a dream of having a place for our students to live because housing is a challenge in Rapid City. For instance, if a student, because we do not have a campus, we don't have dormitories, so they have to find their own place to live. And that's a continuing effort on our part. Next slide. This is a Jasmine Goodiron. She graduated a year ago, and this is her quote for her experience of being supported through our program. And she considered us her personal cheerleading squad. And it's so wonderful when a student will call you after a test and be excited to tell you their grade if they did well. And of course, it's the other extreme if they don't feel like they did well or maybe didn't quite make the level of grade they wanted. They know to call us or text us or email or just stop by because we're always there. And that's part of the mentoring success is that we're there when they need us in some way, whether personally or remotely. So that's the next slide. Okay, Pilamayaye means thank you in Lakota. I really appreciate this opportunity to speak with you and to share with you what we're doing in Rapid City. Thank you.
We've lost Karen. So now we'll turn it over to Mary Siebert, our Director of Global Nursing, to moderate the question and answers. Thank you so much. That was an incredible talk.
Let's see. So Bev, being that we're out here in South Dakota and it happens to be my home state, I'm very curious to see what your feelings are. The history that we all received growing up is not accurate. We all know that. I'm wondering if you see a change in the interest of people from what it used to be, 10, 20 years ago. Are there more people interested in learning the accurate history from your point of view?
Yes, yes, it's happening. And I think it's basically because we have so many of our own people getting higher degrees in the Western way of learning, and they're still quite grounded traditionally. And so they have this ability to walk in both worlds and to be able to understand both sides of the cultures, and are able to verbalize what it is that we need as Native people to make our health disparities and inequities decrease with time. And part of that is having confidence in knowing who you are.
Yeah, I believe that. So a question from Garen to you, Bev, is how can academic institutions such as MGH assist you in your mission for the nursing students in Rapid City or around?
Gosh.
No easy question.
I used to feel embarrassed by saying this, but I no longer do, because because our food cards, gift cards, the very first time that this happened in Rapid City was on a Friday afternoon. This was maybe 4 years ago when we were still new, in our first year, actually, the 5 years ago. A student came and she said, Bev, I've been trying to tell somebody all week, but I'm running out of money, running out of food, and I really don't have any for the weekend. And so we had to have a way to hand them a gift card to go buy groceries. And so this is how we do it. And it saves time. It's hard for a student to ask. It really is. And that's why she couldn't do it for the longest time until it was like an emergency on a Friday afternoon. And so of course I supplied her with some cash of my own, but I realized we needed to get something going in that realm of support for our students. And of course the university did not allow cash in our offices. I learned all this the hard way. I said, but when they told me to stop, I said, well, there's got to be another way. There's got to be another way we can help students at the biological level of need. How can they learn concepts if they are hungry, are worried about their children going hungry, or not being able to get to clinical because they don't have enough gas? It's just a very common sense way of approaching support. And so we do. They did finally agree that we could do gift cards only if it was the oversight was from an outside group, and that is the Native American Nurses Association. The treasurer comes and keeps track of our bookkeeping. So we had to work within the system, of course, but we're still making it happen. So that's one need. And then maybe a group of people getting together and providing a scholarship or some sort of a grant for a student that needs a laptop, or something like that. The needs are there. They're there. And typically it's financial needs that make our students drop out. It's not academic, it's financial. And that's the reality of the whole thing. But what we're doing is working. But we always, because our program is growing, our needs are growing as well. And so, and just words of encouragement, you know, words make a difference. Hang in there. We need you as nurses. We need you in our home places. We need you over here in Massachusetts, wherever, and get a connection going so that they feel support from the people of this country and not just us.
Right, right. So another question. So what, after training and they're out on their own without the support, the close support that you guys provide, how do we retain them in the nursing field? What's, you know, what can we do to keep them in nursing?
Well, again, during the time, the years that they're with us, a huge part of what our mentoring sessions provide, for instance, is self-care and being cognizant of the fact that they can have compassion fatigue, they can burn out. So one of the things I say to students after all these years in nursing is that if you ever feel the need, if you ever feel that you don't feel like going to work every morning, that's a sign for you to do something like change. Don't be afraid of change. Go to pediatrics if you're working in medical floor, you know, just a change within the system you're in. Public health nursing, you know, there's sort of school nursing. There's different areas of nursing, as you all know, that they could shift to another way of taking care of the people.
So, you know, we only have a couple minutes left, but I'm just wondering what your perspective is on the effect that COVID has had on the nursing program or in the tribes in general. I know it's been a pretty dire situation here in South Dakota. So.
It is. And of course, our tribes are trying their best. Actually, my son and his wife came to South Dakota. They actually drove there so they wouldn't have to stay in hotels or go to a terminal, airport terminal. And they noticed that, generally speaking, the people in South Dakota were not wearing masks, but they went to the reservation and they were. So the reservation community seems to be more aware. And part of that is because of the health disparities that were pre-existing that made us more vulnerable. And we are losing a lot of our community members, and they're grieving. And so one way to show your support of the community is to be compliant with CDC. And our tribal members are doing that more than the other population, unfortunately.
We've actually seen that. I feel safer on the reservation than I do out in public, out in Rapid City. So those of us who are working out here have seen the difference.
It's there, it's very obvious.
Yeah.
So just that kind of encouragement, say, I'm glad you're doing what you're doing to protect our people. Just a statement like that, even a group letter from Massachusetts General to OLC College of Nursing or SDSU, and just say that.
Yeah.
Yeah.
Well, thank you, Garen. Do you want to take it from here? We're going to have a small group discussion with Bev, which I'm looking forward to, but I'll let Garen close this.
Yes. I just want to say thank you so much once again. It was a fabulous presentation, and I know it is such an honor for our institution to partner with you and what you do with global nursing and our disaster response team that's out there now. And so we do want to say thank you to everyone that joined us today and invite you guys back next month in January for our next speaker, who is Lois Pace, who is the Executive Director, President of the Global Health Council. So thank you all and have a good holiday season.